In today's health headlines, BA4 and 5 variants. Will these cause a new wave? New information on the unvaccinated and COVID deaths and new data from Pfizer on Paxlovid. It might not prevent other household members from getting COVID when someone tests positive. Joining us now is Dr. F. Perry Wilson, Yale Medicine physician and associate professor at Yale School of Medicine. Doctor, welcome back.
Thanks for having me.
Great to have you. So BA4 and 5 variants now. Will these cause a new wave here in the U.S.?
Yeah, variants just keep coming, don't they? Because the more cases there are around the world, the more variants there will be. BA4 and BA5 arose in South Africa, probably where the original Omicron variant arose. We're not seeing it in Connecticut yet. I just spoke with Nate Grubar, sort of guru on variants here at Yale. Haven't seen a case yet, which is encouraging, but cases are rising in South Africa. Concerningly, it seems like people who have gained immunity from prior infection are not as protected against BA4 and 5 as people who gained immunity through vaccination. So if there are any holdouts there, one more reason you might want to get vaccinated before BA4-5 hits our shores.
Okay, and a new article reports that COVID deaths are not overwhelmingly among unvaccinated. Can you give us some context?
Yeah, this has gotten a lot of play. This was an article in the Washington Post, which notes CDC data that says that 42% of the COVID deaths in this recent period of time were among unvaccinated people. Now, that's substantially less than the amount of 42% of deaths were among vaccinated people. That's substantially less than the amount of vaccinated people in the general population. So vaccines are still effective, but it's not the overwhelming amount of death that you see in unvaccinated people, restricted to unvaccinated people in the earlier phases. But I do want to point something out. The definition of vaccinated here was having received 2 doses of the vaccine. And we know that in the Omicron wave, 3 doses, that booster is really, really protective. So part of the reason you're seeing more deaths among, quote, vaccinated people is because they're really not as vaccinated as they could be.
All right, get boosted, right? All right, new data from Pfizer suggests that Paxlovid didn't prevent COVID among people living with a COVID-infected person. Tell us about that.
Yeah, this was, a bit disappointing of a study. The idea was that this Paxlovid, which works really well when given in the early stages of a COVID infection to prevent hospitalization and death, reduces the rates of hospitalization and death by about 80 to 90%. Could it prevent COVID altogether? And so they gave Paxlovid to people who were living with someone who was newly infected with COVID to see if it could prevent them getting infected. And unfortunately, they still got infected. So a little bit disappointing. But let's remember that Paxlovid is a treatment for COVID. It wasn't designed to prevent COVID altogether. It's designed to be taken once you are actually infected. So maybe this disappointing result isn't entirely surprising, but again, probably the best way to prevent getting COVID is to do your social distancing, wear your masking, and to be fully vaccinated.
All right, Yale Medicine Dr. F. Perry Wilson, thank you as always for the very latest on a Monday afternoon.
Thank you, Lisa.